According to the CDC, dementia patients are estimated to reach about 14 million by 2060, nearly 3 times the number in 2014. Despite advancement in technology and medicine, the question remains why. The answer might be simpler than you think. But before I get into that, let me share a fascinating fact about the brain. Did you know that about 60% of our brain is made of fat? You might not get how much that would be. You heard about the fatty liver, right? When there is a 5 to 10% in the liver, we call it fatty liver. So you could say our brain is full of fat. 60% is fat and half of that fat is omega-3. 25% of the dry brain weight is cholesterol and about 20% is phospholipid. Phospholipid, you might not familiar with it, but don't worry, I'll explain later. So back to the topic, why do we see such a high increasing number of Alzheimer patients? In 1977, the FDA published the Dietary Guideline for Americans. This is when the US government determined which food are good for you and which are bad for you. When the US government publishes such a guideline, it doesn't take long for them to spread around the globe. Anyway, these guidelines basically say that fat is bad for you. So since the 1980s, a low-fat diet has been considered a healthy diet. When you see a juicy fatty steak, what comes to your mind first? Probably cholesterol, right? I have to make a separate video because I have so much to tell you about cholesterol, so please subscribe. And back to the topic, when we eliminate fat, we tend to consume more carbs. And as a result, there is a drastic increase in the number of diabetic patients. Diabetes wasn't common in the past. According to the American Heart Association, they recommend a fat intake of 5 to 6%. And I have to show you what 5 to 6% looks like. According to this study done in England, the average intake of fat for vegan was 5%. So does AHA recommend us to be a vegan? Let's take a look at the DASH diet, the most recommended diet by American Heart Association to lower blood pressure. As you can see, it includes 2300 milligrams of sodium, 55% of carb, and 6% fat. Is it basically saying to minimize the intake of animal products? So this is basically low-fat, high-carb, low-sodium diet, which I think is more of a vegetarian diet, maybe with the chicken breast. When the NIH and AHA set these guidelines, obviously many doctors will recommend this diet to patients. And the purpose of this diet is to lower cholesterol, especially bad LDL and blood pressure. And this is side story, but when I went to the Natural Product Expo 2 years ago, there were hundreds of vendors promoting plant-based meat, which show how popular and demanding the vegetarian market is. Out of all these vendors, only one had a real meat vendor. The funny thing was they had a handwritten banner saying real meats here, and the vendor had lines of people. It was pretty funny. But anyway, we have a drastic increase in the number of vegetarians in the States. And I'm not saying it's bad, but we have a 14% of adults with diabetes. And when we combine pre-diabetes, it becomes 52%. Basically, more than half of adults have diabetes issues, and I don't think this is normal. So why am I keep talking about the diabetes? Because it's one of the important risk factors for dementia. Take a look at this table from the study. The normal glucose level is 90 to 120, and let's say when the glucose level is 100, the risk of dementia is 1. When the glucose level is 120, the risk becomes 1.18, which is 18% higher. When the glucose level drops to 95, then the risk drops to 14%. And this is a huge difference. But remember, this table is for non-diabetic people. This table from this study shows the rate of a brain atrophy with the different HbA1c levels. When the number is higher than 6.5, it's diabetic. And if it's between 5.7 and 6.4, then we call it pre-diabetic. Obviously, if we can keep it around 5, that would be awesome. But realistically, it means your glucose level is about in 90s, which is extremely difficult. So basically, when we have more diabetic patients, the rate of brain atrophy will go up. Therefore, the risk of dementia will go up as well. So just like many people know, we have to stay away from carbs because higher glucose levels might result in our brain getting smaller. Have you heard of the popular keto diet? It's like an opposite of the DASH diet. According to several rat studies about the ketogenic diet and its benefit, it shows improvement in brain function. But we don't typically favor animal studies, right? So take a look at these human studies. They had a 58% fat, 29% protein, and 7% fiber and 6% carbs. I think 58% is a relatively low for keto, but the important thing is to have minimal carbs. The results here show about 30 points difference in glucose level between two groups. As you've seen earlier, even 10 or 20 points difference in glucose level shows a significant increase or decrease in the risk of dementia. And I think 30 is pretty big difference. Also, for the ketone level, the usual diet shows about 0.2, whereas the keto diet group shows 0.95. After 12 weeks, testing for cognition, daily function, and quality of life showed a higher score for the ketogenic diet group. They simply had more fat, fewer carbs, no medicine, no exercise. And here's a new study from Stanford last month. And after 4 months of a ketogenic diet, 79% of participants had a clinically meaningful improvement and 100% reversal of metabolic syndrome. This seems better than medicine, I feel. But it's just a one study, so let's not jump into conclusion. But still, just by changing the diet, it could show meaningful changes in mental illnesses, and this is a big deal. At the beginning of the video, I mentioned the phospholipid, right? One of the most important things this phospholipid do is work as a cell membrane. And plasmalogen are one of the phospholipids that are very important. This is because the brain has the highest concentration of plasmalogens in our body. Why? Because of the nerve cell in the brain. When nerve cells send a signal, we have to use the thing called synapse. This is where this nerve cell can communicate, and if this function drops, it could cause a degenerative brain and nerve disease such as dementia and Parkinson's. Restoring the functionality of this synapse is a key point to treating or preventing dementia. When synapse activity occurs, it requires extreme chemical reaction, and by doing that, it requires a large amount of phospholipid. When we look closer at the synapse, all the blue circles are phospholipids and the small yellow circles are cholesterol. So you could think of it as we need fat and cholesterol in order to have proper synapse functionality. So when we are lacking phospholipid and cholesterol, synapse function drops. Why? Because the brain is made up of 60% fat, 24% of phospholipid, and 22% of cholesterol. So nerve tissues needs this fat and cholesterol. There is one story I want to share with you. I'm not an expert in this field, so I'm not 100% sure if it's relevant or correct, but I think it's worth sharing. About 10 million years ago, the human brain was small. As the time passed, the brain got bigger and bigger. By 2.5 million years ago, the size of human brain drastically increased. This was when humans started hunting with more efficient tools and began eating a lot of animals, meaning they consume a lot of fat and proteins. However, there is one point where the size of the human brain drops. This occurred when humans transitioned from hunter-gatherers to agriculturists, which happened about 15,000 years ago. When humans no longer had to hunt and started consuming more crops, the brain size decreased. Neuroscientists emphasize how quickly the size dropped compared to how long it took for a brain to increase in size. They said there was about 10% reduction in size from 40,000 years ago to now. Pretty interesting, right? Because animal products contain not only fat and protein, but also lots of important nutrients like vitamin B, K, and others. And I'll just show on the screen. It's easier to list what animal products don't have. And just like this article says, which I agree based on the title, animal products have all the necessary nutrients to keep the brain healthy. When I look at elderly patients in my office, they tend to lean more towards a vegetable dominant diet. Not just because they think it's healthy, but also because meat gives them uncomfortable stomach. When it comes to treating digestive issue, Eastern medicine is very effective. So if you have a chronic digestive issue like acid reflux, gas retention, IBS, or anything else, please try out Eastern medicine. Also, when we look at the statistic of dementia by gender, female shows a higher risk. We can all agree that females tend to eat less animal products than males, right? So there is definitely a correlation between how we eat before dementia happens, which is very important. But let me get this straight. I'm not suggesting a carnivore diet. There is no one style of diet that can benefit everybody. It depends on what you're experiencing, your lifestyle, and medical condition. You need to find out what's best for you. The only thing that I can strongly recommend to everybody is please stay away from anything processed as much as possible. Because once we started to eliminate certain food, what can we possibly eat at the end? Eating is one of the joyful things in our lives. Trying out new restaurant, local foods when you travel, even street foods are fun. So I'm a strong believer in everything in moderation. From an Eastern medicine perspective, everything in our world is there for a reason. And the same goes for the food as well. If there is a benefit to certain ingredients, then might be a downside, and vice versa. When you have a meat dominant meal today, you could have a vegetable dominant meal tomorrow. Just balance it out. I recently got this Dexcom real-time glucose monitor, and I'm trying to make a short on which food caused the most spikes. So please subscribe and let me know in the comments what kind of food you want me to try. Hope this video was helpful, and remember, health is wealth, so invest in yourself. This is Dr. Sean making health easy for you. See you next time.